Hi guys, I want to quickly go over iron deficiency anemia and iron levels in your lab and what markers are important to check when you are checking your iron. I also want to quickly go over inflammation. You have seen my post before. I always talk about inflammation. Inflammation is so important. Inflammation can alter red blood cell production and the health of your red blood cells in your bone marrow. So now let's talk about what happens in inflammation or infection. So what happens is that there are these proteins that are called hepcidin, and these proteins, what they do is they trap the iron so that in case of inflammation and infection, these pathogens don't access to the iron so that they won't grow. So what happens is that these protein they trap the iron, and so then now what happens is that you have a high storage iron, and these protein also help ferritin, that is your I would like to say bank account that stores your iron. So now your ferritin goes up, and when you do a lab, you see that your ferritin is high and your circulating iron is low. So in a case of autoimmune disorders like lupus, Hashimoto, rheumatoid arthritis, your iron is trapped and you don't have much iron in your circulation. And so what happened is that they need to treat the underlying condition, which is the inflammation. If they don't treat the underlying condition, which is the inflammation or the autoimmune, then what happens is that if they give you iron, your iron will still be stored because of the inflammation. So you're pretty much not treating anything. So it's very important in that case. They do run inflammation markers such as C-reactive protein and ESR. So what is suggested in a test for iron deficiency? That would be your CBC, your complete blood count. That would show you the whole hemoglobin level, white blood cells, red blood cells, MCV, ferritin level, iron saturation, transferrin saturation, and TIBC, which is total iron binding capacity. It's also very important to check for your B12 and your folate, which is your B9. These are your cofactor for red blood cells, and in a case of megaballistic anemia, that is your marker to check. Now, the best way to check for that would be checking for homocysteine and methochronic acid. Now we can get to the treatment strategy. In the case of iron deficiency, the fastest way to get your iron level up is to take ferrous sulfate.